Hello, my name is Johanna Goebel. Welcome to my presentation. I will speak about the case report Giant Isolated Omphalocele, Role of Prenatal Diagnosis in Prognostic Assessment and Perinatal Management. So let's continue with the introduction. First of all, let me explain the word omphalocele. It is an ancient Greek word for umbilicus and rupture, meaning that the intestine and liver aren't growing in the belly like they are supposed to, but outside in a sac, because the umbilic ruptured during the growth of the fetus inside the womb of the mother. So, this case report concerns a 34-year-old pregnant woman who was told at her 12th week echography that the liver of her baby was growing in a sac outside the belly, a malformation called hepatic omphalocele. It's a condition often associated with chromosomal abnormalities in the DNA, like trisomies 18 and 13, and a rare genetic disorder called Beckwith-Wiedemann syndrome. Some procedures were performed on the fetus and newborn. Firstly, to exclude a genetic cause, the doctors took a small sample of the amniotic fluid around the baby. The test results were normal, but enabled the doctors to eliminate a genetic disorder. After counseling and discussing the possible outcomes of this abdominal malformation, the couple decided to go on with the pregnancy. At 38.3 weeks, the mother underwent surgery called caesarean section, which goal was to take out the baby safely and avoid a natural birth. A team of different specialists took care of the baby and the mother to assure the security of both humans. The baby boy was immediately admitted in the neonatal ward to reduce the risk of infection. Surgery was performed only a few hours later to close the belly as quickly as possible by putting the liver back into the abdomen. The pressure inside the belly increases, and therefore the baby was put into a special sac to make sure that no other conditions occurred due to this added pressure. The newborn evolved favorably during the following days and was able to quit hospital after 21 days. But other procedures had to be made on the baby. At 3 months of age, a loop of his intestine moved and landed in his groins on both sides. Doctors believed it could be the consequence of increased abdominal pressure due to the surgery. They surgically repaired it on both sides by replacing the loop of intestine in its right place. Now, 1 year later, the baby is doing well. And now, let's finish our presentation with the discussion. First of all, the doctors made their diagnosis of omphalocele on the basis of an abnormal ultrasound at 12 weeks of pregnancy, which is systematically performed during pregnancy. No symptoms led to the exam and appointment. During the ultrasound, the doctor didn't find any other abnormalities. Neither did he find any genetic disorders. So it's very important to do an ultrasound even if it's just for a simple checkup. Secondly, to follow the evolution of the baby's growth, the doctor scheduled appointments every 3 to 4 weeks. All schedules were performed by the same doctor to minimize the possible errors of measurements during the ultrasound. And finally, the early discovery allowed the doctors to form a team with a pediatrician, obstetrician, anesthetist and a surgical team in order to improve the survival and quality of life of the newborn. The team was able to choose the best treatment to avoid any mortal consequences. That is why doctors vividly recommend the first trimester ultrasound. Neither the baby nor the mother get hurt. It is a simple exam and it helps the doctors to act wisely and quickly if problems occur. Thank you for listening.